So the PROMOTE ALI trial is a prospective multicentre observational study that is focused on lower limb ischemia. So acute lower limb ischemia is something that is not very well investigated. And most of the studies we have are quite old. So they are at least 20 years old. The evidence is mostly registry data, also collected from the 90s. So we kind of have a lack of evidence, of current evidence. And we don't know what the current strategies are in Europe. So our aim was to make like a snapshot of the current strategies that European centers use to treat acute limb ischemia patients. The acute limb ischemia is something that is under-investigated, and we have this problem that these patients are not well represented. They are acute cases. Acute issues are not, let's say, not something that a lot of investigators want to focus on, because it's hard to recruit patients, and that's something we also see. So our aim is to recruit 500 or more than 500 patients. We have a very open study design, so we include basically everyone who has a lower limb, acute lower limb ischemia. So everyone who's able to consent can be included. Doesn't matter if it's iatrogenic, traumatic, acute limb ischemia. We want to know everything, because we want to know how people are treating everything. So that's it. And we have currently more than 50 centers all over Europe that are including patients. We are mainly interested in the first 90 days. So we can kind of recruit the patients, see how they are treated, if they are treated, and then we look how their 90-day follow-up is, and because most of the action is happening there. Well, before we can design randomized controlled trials, we need to know what we have to design them for. So basically, we want to know what kind of strategies can we compare. Where is what is missing? There was also a nice because the session after my talk was about acute limb ischemia, and one of the things that was remarkable was that a lot of the things that are recommended in the European guidelines are not finding their way into daily practice. So, for example, just a bit more than half of the patients are receiving heparin at the time of diagnosis, which is something that should be done for all patients, which is an issue. So we also have a communication issue for guideline recommendations. So, well, as we have kind of a slow recruitment of study sites because of legal issues and the recruitment of patients, we extended that a bit. Initially, we just wanted to have 1 year of recruitment phase, but we extended it to 18 months. So I guess at the mid of next year, we will have all the follow-up completed, and hopefully by the end of next year, we will have our manuscript at least under review or submitted to hopefully the European journal. Well, one major issue, we are quite a young group, so young consultants, vascular surgical trainees, other vascular specialties. We are still kind of building up our group, so we always invite people to join us. We have future projects going on, we have survey data, we have upcoming observational studies, so everyone should be free to contact us and just be part of the team.